Director of Research at Shriners Children's Hospital is joining us today. We have Dr. Farshid Gilak, and he and a team of researchers have made incredible strides for those who have juvenile arthritis or rheumatoid arthritis. This next actually medical expert segment has been sponsored by Shriners Hospital, and Dr. Gilak is joining us now. I mean, what a fantastic development for you and the team. Congratulations.
Thank you so much.
You're welcome.
Really delighted to be here.
I'm excited that you're here as well. I mean, let's break this down. You guys have been working on smart cells. They've been bioengineered. How does this work?
Well, we've been trying to treat these chronic diseases that children have, like rheumatoid arthritis, or in children it's called juvenile idiopathic arthritis, JIA, or juvenile arthritis. And children have to take these strong biologic drugs for their entire lives. And it suppresses their immune system, and it's very difficult getting injections several times a week, or even infusions where they have to go to the hospital and get a intravenous line. What we thought is that we could use stem cells, cells from your own body, and reprogram them so they could deliver those drugs to the patient. So that's what we came up with, was a concept of smart cells. So we reprogrammed these cells so they could sense arthritis and create the right drugs at the right time, and just enough of them so that you don't suppress the immune system.
And that is pretty neat. I mean, you mentioned that these smart cells are kind of anticipating a flare-up in these young kids, right?
Exactly. They're programmed to sense a flare of disease, and so before they can sense pain or before the inflammation goes from their joint to the rest of their body, the cells turn on the drugs and shut it off. And then they shut off the drugs automatically when that stops.
Now that is pretty cool. I mean, what has the team done to create these smart cells so they could last longer in the body that's really beneficial for you?
Well, that's a great question. So it was a long, multi-step process to create these, as you can imagine. So the first thing we had to do was create the cells, and that involved basically writing the equivalent of computer code, but for a cell, which is the DNA code. And so we have to reprogram the DNA. Think of the cell as like a little iPhone, and we have to put a little app in it that says...
That's the perfect way of thinking of it.
And we can plop the little app, little lines of code that are in DNA code, but then we have to insert that code in the right place. And to do that, we used a technique that was very recently developed in 2012, 2013, which you might have heard of, called CRISPR. And CRISPR is an enzymatic system that allows you to edit DNA. So we could put those programs in the cells. And once we tested the cells, we had to figure out a way to keep them in the body. Because if you just inject the cells, they're gone in a day or two.
Wow.
So we had to grow a little piece of tissue, a little implant, basically a piece of cartilage that could sit in your joint or sit under your skin and keep the cells there for months or years even.
Wow. Now that is incredible. This has been a breakthrough that has just recently happened. You've been doing this in mouse trials. So now what is the next step to make sure that kids will actually be able to use these?
That's a great question. So what we've shown is that it works. And so far it's been completely safe. So what we need to do is run some longer term studies, make sure they last long enough to make it worthwhile. And then we talk to the Food and Drug Administration, the FDA, that regulates these types of implants. And it's fairly complex for something. Usually they deal with either drugs or devices like, metal and plastic things that go in your body. This is something completely different. It's living cells that are giving off drugs. So we have to talk to them and go through a process which will probably be, several years of work to show, again, that it's safe and that it works in people. And if all that goes well, we're hoping 5 years, but probably a little bit longer, we can get it into patients.
Well, congratulations on this breakthrough. I cannot wait to see how and when this comes to fruition, but you and your team have done incredible work. So thank you so much, Dr.
Thank you so much.
Absolutely. In St. Louis, if you would like to learn more about Shriners Hospital, how they are using incredible researchers to have groundbreaking innovations for people who suffer from rheumatoid and juvenile arthritis, you can head online to their website at shrinersstl.org, or you can call 1-800-850-2960.